And good afternoon, everybody. Stand by for Health Director Gibby Harris.
Good afternoon, everyone, and thanks for joining us this afternoon. I'm going to start with our typical data update. As of noon today, we'd had 82,968 cumulative cases in Mecklenburg County since March. We've had 754 deaths. I will say that we have seen the majority, or at least 50% of our deaths being in long-term care facilities. We are starting to see that shift just a little bit in terms of percentages in our community. We've got 63 current outbreaks in congregate living facilities. That's mostly long-term care facilities, but we do have outbreaks in several of our shelters right now. In addition, we've got 3 schools and or child care settings that are in cluster status. Our data came out a little bit late today. We've added our immunization data to the report, and it just takes a little while to get all of that together. But what I will say is our metrics are trending in the direction that we had hoped for. We've got 671 average cases per day, which is down. We've got 455 average hospitalizations per day, which is down, and 11.7% positivity rate, which is down. That is all great news. And we are pleased to see that and hoping for a continued trend in those directions. I will remind you, though, that it was announced earlier that we have experienced the first confirmed case of the UK variant in Mecklenburg County. We do know, based on the research that's been done in the United Kingdom, that this variant is more contagious, more easily spread. There was an announcement yesterday that the Brazil variant was recognized in Minnesota as well. What that does for us just is makes us re-emphasize the need to continue with our prevention work in this community as we continue to work on vaccines. As of today, the state has shown on their dashboard that Mecklenburg County has administered 47,410 first doses since we first started receiving vaccine. I do want to also recognize the fact that availability of vaccine continues to be an issue for us. There's been a lot of talk over the past weekend about how the vaccine has been allocated over the past week. I will recognize the fact that we got additional doses in Mecklenburg County. Last week, we did not get those additional doses for this week. We are still getting the 1,950 doses. So I just want to point out the fact that vaccine availability continues to be an issue nationally, as well as at the state level, as well as in North Carolina. The Secretary has recognized that fact. She is wanting to make sure that we have some idea of what we're going to get from week to week. She's implementing a new allocation process. All we know at this point in time is that when we get our allocation this week, we'll know that that's the same allocation we'll get for the next several weeks. We don't have any idea whether that will be more or less or the same as what we've been receiving. So as data availability continues to be an issue, we continue to ask for patience from the community. We know that the demand is much greater than the availability, and we'll continue to get this vaccine out as quickly as we receive it. But again, in addition to the variants, it really reemphasizes the fact that we need to continue to do the things that are included in the directive. We need to be washing our hands, wearing our masks, socially distancing, and staying at home unless it's absolutely necessary for you to be out in the community, whether that's for work or some essential service that you need to access. So please continue to pay attention to those recommendations from public health and do what you can to be part of the solution in our community while we're waiting for additional vaccine. I'm going to turn it over to Meg Sullivan to talk about our vaccine situation in particular.
Thank you, Gibby, and good afternoon, everyone. As Gibby mentioned, I'm just going to provide a brief update around vaccines for Mecklenburg County Public Health and just reinforce a few of the points that she just made. So for quick numbers, as of Monday evening, we have administered over 12,600 doses of the vaccine, which includes over 11,200 first doses and almost 1,500 second doses. Again, to emphasize, we continue to vaccinate individuals who meet the eligibility criteria for Group 1 and Group 2 as per current North Carolina Department of Health and Human Services prioritization guidance. Reminder, Group 1 is for healthcare workers with current in-person patient contact and long-term care facility residents and staff. And Group 2 is individuals ages 65 and older, regardless of health status or living situation. As I mentioned last Friday, we have had several vaccination events at community sites over the past several days, which includes with our shelters, our jail, both of our federally qualified health centers, Gaffney Health Services, Hoskins Avenue Baptist Church in partnership with StarMed, and in Livion. Through these events, we were able to vaccinate approximately 800 individuals, largely due to the additional doses of Moderna we received this week. This was in addition to our first and second dose clinics using Pfizer at Bojangles and Medic headquarters. We have already administered all of the first doses that we had received as of yesterday. As Gibby mentioned, today we received an additional 1,950 first doses of Pfizer, which are the only doses we will be receiving this week. And we will continue administering these vaccines via appointment at Bojangles, and will be in the community providing vaccines at additional shelter sites and a long-term care facility, in addition to returning to multiple long-term care facility sites to administer second doses. As always, our vaccination distribution this week will be limited by the supply that we have available on hand. And again, we will be completing administration of all the doses we received today by next Monday. Gibby also mentioned we are still waiting additional details from the state regarding our supply for the coming weeks, but we know that vaccine supply continues to be limited across the state and across the country, and we continue to anticipate the vaccine that we receive will be much less than our capacity to administer it. We do remain optimistic about the possibility of one or more additional vaccine types receiving emergency use authorization in the near future, which would obviously greatly help supply. But at this time, we're still waiting for additional data, and there's no specific timeline that is available. And then finally, we continue to work to get out information about the safety and efficacy of the vaccine and current eligibility criteria through our community partners, our community leaders, media campaigns, our website and hotline, and other avenues. And also work really closely and collaborate with both hospital systems regarding vaccination in the community, as we all remain focused on prioritizing individuals and communities who have been disproportionately impacted by COVID, including specifically communities of color, as allowed by supply. And I always, just like Gibby, like to take the opportunity to reinforce that while we remain committed to delivering vaccine as quickly and equitably as possible, our focus, as always right now, needs to continue to be on preventing spread in our community through strict adherence to public health guidelines and precautions. Thank you.
Thank you, Dr. Sullivan. First question is Claire Donnelly, WFAE.
Hi there, Claire Donnelly from WFAE. Thanks for taking my question. It looks like Mecklenburg County's trends are starting to improve. Gibby, I'm wondering if you can speak to why you think that's happening?
Thanks for that question, Claire. There probably never is a single reason for any of what's happened during COVID. There's multiple things that impact the numbers and the way our communities react and everything else that is related to this pandemic. I do believe a couple of things are going on right now. Number one, we are seeing the decrease in the impact of the holidays on our numbers. So as we get further away from the holidays, we were hoping to see our numbers come down. And I think we are seeing some of that impact from the holidays decreasing over time. The hope is also that people have been paying attention to the directive and staying home and doing the things that we're asking them to do, which helps bring those numbers down as well. And I just want to reemphasize that just because the numbers are coming down does not mean we can take our foot off the gas. We need to stay focused on doing those things to keep those numbers down so that we can safely reopen things in our community as we move toward a vaccinated community. So I think those two things have had some impact, and there may be others as well, but those are the two main things that I think have helped get our numbers down.
Next question is Paige Pauroso-WBTV.
Hi there. Thanks for taking our questions today. You mentioned some of these things already, but outside of shelters, which you mentioned some other ones, what's being done to bring the vaccine to some of these underserved and vulnerable communities who are already at a disadvantage for transportation limitations maybe or mobility issues? And can you elaborate on some of the plans that might be coming in the future when that vaccine supply is higher that these communities can maybe look forward to?
I'll mention a few things, and then Dr. Sullivan may want to add to this. We're working regularly with our healthcare systems as they are starting to get out into the community. There was an event last week that Atrium had at one of the churches in the community. There was one over the weekend that Navant had in a church in the community. And as Dr. Sullivan mentioned, there were a number of events that we worked on at the latter part of the week and through the weekend. We are continuing to plan and work with community partners to make sure that we have the ability to get vaccine into those areas as we have vaccine available to us. We're also looking at partnerships with a number of other larger entities in our community who can help us get the vaccine out. We want to be prepared once the vaccine starts becoming available. And we're going to make sure that we have things ready to launch as soon as that is available. And I'll ask Dr. Sullivan if she has anything else to add to that.
No, yeah, I think you summed it up really well. I think it is, as we've said multiple times, it is a central focus of our planning. And I think, we talk a lot about uncertainty of supply and learning information a few days before, but as we do long-term planning and anticipate the time when the vaccine is more readily available, and even when we have more than 2 vaccines available, this is, and especially in collaboration with our hospital systems, and then as other enrolled providers also get vaccine, that will incorporate also into our planning as we do this, and it continues, as I said, to be a central focus.
Next question is Lauren Lindstrom, Charlotte Observer.
Hi, Gibby. Sorry about that. I'm wondering, regarding the UK variant, do you have concerns about the limited amount of information that can be gleaned from the screening capacities that we have now to understand its prevalence in our community? And if so, do you plan on either pushing or advocating for additional screening capacity in North Carolina in your capacity to do so?
Thanks for that question. I think that we're always advocating for additional screening capacity. It's difficult to know what's happening in our communities without the information that comes from that type of screening. I think it helps us in understanding the types of virus that we have in our community at this point. So I do think that that's important, and especially as we learn more about the variants and how susceptible they are to the vaccines, and how transmissible they are in our communities. But I do want to emphasize the fact that regardless, we know that we're going to have variants. That's what these viruses do. They mutate over time, especially the more we have in our communities. It allows them to make changes to be more prevalent. So we know that we're going to have that. So I think it's critical to say, regardless of what we have, we've got virus in our community, and just reemphasizing those prevention measures it's something that we have to do while we're advocating for more ability to understand what virus we do have.
Next question is Alison Kuznitz, Charlotte Observer.
Hi, Gibby. It's Alison from The Observer. We've previously seen forecasters saying how many possibly asymptomatic cases we could have. Do you have a similar framework of how many more cases of that UK variant could already be circulating in Mecklenburg County? And can you talk about your directive? It's set to expire next week. Would you consider extending the directive, adding more restrictions, knowing that we have a now highly transmissible version of the virus?
Well, I think that we are, again, we don't know how much of this new strain we have in our community. We know it's here. And that's the main thing we need to know right now, and we need to be taking the precautions that our community needs to take to prevent its spread, as well as the original strain. So the virus is the virus, and we are combating that in the best way we know how right now. Vaccines are important, but again, the prevention measures are the things that are going to make the difference in the short term anyway. In terms of the directive, we are considering what to do with that directive, and we'll make an announcement about that later in the week. Right now, the numbers are trending in the right direction. We want them to continue to do that. We're watching them very closely, and we certainly don't want to do anything that's going to reverse that. So at this point, we have not made final decisions one way or the other on the directive, but the main point I want to make is that we're asking our community, regardless of what we do with the directive, to continue to implement the things that are in the directive, because those are the things that are going to make a difference as we move forward until we're well vaccinated in the community.
Next question is Tanya Mendis, WCNC.
Hi, thanks for taking my question. So my question is kind of two-part pertaining to schools. Based on the metrics that you're seeing right now, how are you feeling about what's happening in CMS schools? And then second, we're hearing more conversations are taking place, at least on a preliminary level, to stand up vaccination sites at CMS schools. I'm hoping that one of you can speak to that, what those efforts would look like. Would you just be targeting teachers and school staff? Would they be open to the general public? So just more information if you have it.
Thanks for that question. I think that the schools are a topic that we hear from almost daily in our emails, as I'm sure the school leaders do as well. As we've said from the beginning, we understand the importance of our schools being open, and we understand the importance of our children being in that environment and being able to learn in that environment. And that was one of the reasons, but not the only reason for the directive. We needed everyone to consider limiting their exposure in the community because of the amount of virus we had. The amount of virus we have is still high, but we are moving in the right direction, and we want to do everything we can to support the schools being able to open back up again, but we want them to be able to open back up safely. And the importance is that everyone needs to contribute to that, not just the teachers and the students, and the staff that work in the school systems. Everyone has to contribute to that by limiting their exposure in the community and only being out when they need to. So we're going to continue to encourage that and support the schools as they grapple with decisions about what to do next. Hopefully our numbers will continue to move in the right direction, and on the 15th, when they're slated to open again, they'll be able to do that. And unfortunately, the vaccines distribution sites at the schools. I know that's being considered at this point. It's part of the planning process to look at all the options that we might have. A lot of that probably depends on whether the schools are open or not. If they're open, it's difficult to use their sites for vaccination sites. So we'll continue to consider that and make decisions as we move forward, but no decisions have been made at this point.
Next question is Erik Spanberg, Charlotte Business Journal.
Gibby, this is Erik Spanberg. I had two questions for you. The first is, what would you say to business owners so that they don't misinterpret the improving trends and turn that into a potential problem in terms of community spread? And then secondly, you've talked so much in recent months about holidays from Memorial Day to Labor Day, 4th of July, Christmas, on and on. How does the Super Bowl and potential gathering compare to those events you've been worried about in the past?
Oh my goodness. In terms of our businesses, again, the directive was not just for our school systems, as a lot of people have believed. It was aimed at our entire community and our need to make sure that we are limiting exposure. And as the numbers trend in the right direction, it's imperative that our businesses understand that they still need to limit exposure in their facilities. We know that they need to be open. We know that they need the business, but at the same time, we don't want to have to reverse at some point because our numbers have spiked again. we need to be continuing to move in the right direction with our numbers, and that means everybody needs to be part of the solution. And our businesses are in that position as well. They are important on any number of levels, and part of their importance is making sure that they're part of the solution around this virus. So we want to make sure that they understand that we still need them to limit exposure of others in their facilities. Around the Super Bowl, obviously that is a big opportunity for people to get together and enjoy the games and spend time in large groups. And that is not the best option this year. It's like we've said with all of the other opportunities for people to get together, that this is one year when they need to consider differently how they celebrate, how they engage with others, and that they really limit their exposure. So again, asking people to enjoy the Super Bowl with those individuals that they live with, and not bringing others into their homes or going out into settings where they have the potential for being exposed. So we will ask the same thing for the Super Bowl event as we did for all of the holidays that we've had up to this point.
Next question is Katie Peralta, Charlotte Agenda.
Good afternoon, everyone. I apologize if this has been addressed. I'm kind of late in joining, but I don't think it has. Have there been any developments in determining what role the local government plays in helping facilitate vaccines among frontline workers, such as those who work in construction, in grocery stores, et cetera? And also, are there any updates on what the identification protocol is, or is this sort of just a trust system at this point?
Yeah, there are several things that are happening right now. Obviously, we don't know when Group 3 is going to become eligible. A lot of that depends on direction from the state, but we are already having conversations and planning with our other vaccination partners about the best approach to working with these populations. The other thing that's going to be happening is fairly soon, the state is going to be putting out a bit of an algorithm for people who fall into Group 3 that will allow them to work through that to see whether they're actually eligible or not. So we will work with the state on this as well as our local partners to come up with our plan for Mecklenburg County on how to get them vaccinated as soon as vaccine is available.
Thank you, Director Harris. The floor is now open for follow-up questions.
Hi, this is Chloe with WCNC. Thanks so much for doing this. Just wondering, since it seems like the state is prioritizing getting bigger allocations out for those mass clinics, if the county's allocations do get smaller, will that impact some of the appointments that are already scheduled?
So as we understand it from our conversations with Secretary Cohen, if they're able to get an appointment and come in, we will vaccinate them. The only restriction is that you need to go back to the same place where you got your first vaccine to get your second vaccine. You don't need to be, we've had a few individuals that have come up from Florida that got a vaccine down there and wanted a second vaccine up here. You need to go back to the same place. In terms of how we put that in the database, I'm not sure whether Dr. Sullivan knows the answer to that. I'll ask her to respond.
Yeah, I mean, I think we just put in the information that we have available in the database.
I mean, we still have to account for the vaccine that we're giving, and the only database that we have available to put that into is the North Carolina system.
Gibby, this is Erik again. A quick question for you, and I'm sorry if you've already answered this in the past couple of weeks, but we've heard Dr. Fauci and others talking about the idea of doubling up on masks. Do you agree with that? Is that anything that you plan to stress or emphasize in the coming weeks?
Well, we have emphasized since the beginning that wearing an appropriate mask and wearing it appropriately is what people need to be doing. And an appropriate mask has multiple layers to it. It's not a single layer mask. We do see some situations where people are wearing, and all gaiters aren't like this, but some of them are a single layer and they don't provide the same layer of protection that a multi-layer mask would provide. So again, the emphasis needs to be on wearing your mask, wearing it all the time when you need to be wearing it appropriately, and making sure that you are wearing a mask that is going to provide the protection that you need. I've seen a number of people wearing double masks in different situations. I can't imagine that it hurts as long as you are able to sufficiently breathe through both masks. Dr. Sullivan, do you have anything you want to add to that?
I think I would just reemphasize, the most important thing is to really focus on the prevention measures and first think about if you need to be out and engaged in that activity. And if you do, to make sure you are wearing an appropriate mask appropriately if it's an incredibly high risk activity and or you are particularly high risk for complications, you would definitely want to think about the level and number of masks that you're wearing. But again, the most important part is A, to stay home unless essential activities, and B, if you are out, to make sure you're wearing a mask appropriately.
And wearing a mask appropriately means that your mouth and your nose are both covered at all times.
Okay, we have time for one more question.
Gibby, it's Alison again from The Observer. Can you talk about why we're still seeing so many active outbreaks at long-term care facilities despite cases decreasing in the community? And what ripple effects does that have for these folks getting their COVID vaccines?
So we have seen, with the additional cases that we have had in our community since Thanksgiving, we have seen an increase in the number of long-term care facilities in outbreak status. Unfortunately, once that virus gets in those settings, these folks are very vulnerable to the virus, and it spreads fairly rapidly. And that's what we've continued to see over the past month or so. We continue to work with those facilities diligently to try to help them get those numbers down, to get out of outbreak status. And that will continue. We're hoping that as more and more of them are vaccinated, that will help as well. But as long as we still have high numbers in our community, we have staff and in some cases others visiting in those facilities who have been potentially exposed as they come out into the community, it just increases the likelihood that we'll see these outbreaks. So again, if people are positive, we're not vaccinating them. If they are positive and have come out of isolation, there's no need or no urgency in getting them vaccinated. So we are trying to make sure that we're getting those who have not been exposed and who are not actively infected or getting vaccinated as quickly as possible. The federal system that involves CVS and Walgreens, if you'll look on the state site, they are not getting the vaccine out as quickly. And so we're hoping that they will step that up. And the facilities, as you heard from Dr. Sullivan, that we are responsible for because they did not sign up, we've been fairly successful in getting the vaccine out into those areas and are already starting to do second doses with some of those facilities. So as time moves forward, we're hoping that the number of outbreaks are going to diminish. Okay, thank you all for spending some time with us this afternoon. Have a great afternoon.